Welcome to our latest episode of the Lebanese Physicians Podcast with Dr. Wassim Abdallah. Today we will be discussing the new infection that everybody's talking about now, which is Cyclospora, causing a lot of diarrhea and causing people to avoid a lot of things such as swimming pools, vegetables, fruits, and stuff like that. Dr. Wassim Abdallah is actually currently an ID or Infectious Diseases faculty at Emory University. Welcome to the podcast.
Thank you, Khalil. I appreciate you having me.
Seems like I've never heard, I'm in medicine myself and I've not heard about this infection a lot. Can you tell us a bit about it? So what exactly is Cyclospora and how does it cause disease?
Yeah, of course. Cyclospora is a parasite. It's a protozoan parasite in the genus of what we call the coccidian parasites. So they are intracellular. It's the same group that has, for example, Cryptosporidium that we hear about it, I think, a bit more often. It's a more frequent one, but also Toxoplasma is part of this group. Most of this group is related to foodborne or GI illnesses. Toxoplasma, of course, is not, but Cyclospora is part of that group.
This is basically like would you say a parasite?
Yes, it's a protozoan parasite. It used to be called in the group of the unicellular animals historically. That's how it was described. So it's basically a parasite that's made out of one cell, and thus it needs to rely on a host to get its nutrition, its resources to be able to survive. And so it's very reliant on a host. And in this case, in the case of Cyclospora specifically, humans are the only host.
Okay, interesting. But it looks like it's been out there for a while, but why are we hearing about it a lot more over the past couple of weeks?
Yeah, we are hearing about it because the number of cases this year so far is around 7 times more than the number of cases last year. And we are expected to exceed it by even more than that by the time the season ends. Usually the season is between May and the end of July or August. So we are expected to see a lot more cases, and because of that, now people are more interested in it. But it's actually an infection that is quite endemic, I would say, even though it's not very common. It's an infection that is quite endemic in the United States. It's also became more and more endemic over the last decade, but has existed for a very long time. And it is also an infection that is very frequent in Central and America. A lot of the returning travelers with diarrhea, this is how people used to conceptualize it in medicine before. And people travel medicine used to see it, know about it, and rest of us who are not in travel medicine really rarely see it. But then since 2016 till now, cases and this year obviously is like a uniquely higher. And that's the reason why we are now considering it as more of, okay, this is a diarrhea that we should think about for people who did not even travel. And so
how is it? Yeah, so that's the thing, because typically it's like traveler's diarrhea, right? So why has it increased much this year?
The first reason is obviously a globalization of the food supply chain. This is a parasite that is oocysts of the parasite that are the thing that become infected is very resistant in the environment. We can send it from any country, from the US to any country around the world, and could be able to survive very strenuous environment and able to infect people weeks later and months later in a different place. And so I think that's one of the reasons, and that's why we see, especially now we're starting to hear more and more today and yesterday about the origins of this specific outbreak in the Michigan, Midwestern state area, Northwestern Ohio, is related to produce that has been made somewhere in California or in Mexico and has made it to the Midwest and caused. So I think this quality of being very hardy, very resistant because of the cell wall that this has allows it to do. Now, the other thing is that this parasite, to be able to survive, transmit to other people, it needs the oocysts which are the parasite, needs to sporulate outside of the host, which is here, and as in this case, humans only. And to be able to, they need to be in a warm environment, and that warm environment is becoming more and more common in areas where it was not as common before. That comes in under the umbrella of what's happening in terms of climate change, which allows also not only the globalization of the supply chain, but also allowing these kinds of parasites to sporulate in places where it was a bit harder before that to sporulate and cause more outbreaks. And obviously the last thing is the fact that we have bigger access to PCR and sequencing testing that's allowing to detect it more. So I would say it's like these three components are most likely the main cause of the increase in numbers.
Interesting that you discussed climate change as part of the reason for increased, I guess, making it more endemic and more transmissible. But so, and that's what I've heard before, even for other viruses like COVID and others, people blame climate change for part of the reason people are getting more infections these days.
Yeah, and this is not very it's obviously at the baseline theoretical, but also it's very clear that we know that there's the higher the temperature, the more humidity, those eggs or those oocysts are able to better sporulate. Dr. Shadi Haj, that you probably know, and I worked also on histoplasma, and we have seen that the soil temperatures increasing in the northern states like Michigan has allowed histoplasma to become more and more common in those areas. So the fact that the temperature is increasing is directly related to a lot of these fungal and parasitic and bacterial and even viral infections.
So just to learn, so how is the disease transmitted? So basically you eat like a fruit or a vegetable that has the parasite or protozoa on it or the oocysts, and then what happens afterwards?
Yeah, so that's an important question and a common confusion for people outside and inside of medicine. So these eggs so the infection doesn't happen usually from one person to person directly, and the main reason is because these oocysts, the eggs that are shed by a person who has that parasite, do not sporulate at least for days to weeks, meaning that if you're a cook in a restaurant is making food and they just have their hands contaminated and that causes your food to be contaminated, that's not going to cause you to have the disease. So it actually goes back to the produce itself that is used. So this has to have happened days to weeks before you consume it for it to happen. That's why the direct person-to-person exposure in this case doesn't happen. So meaning that the host that had the disease was able to shed those oocysts that are unsporulated into either the water system or the environment or their hands potentially, and then they have to have infected the produce before harvest or it has to be immediately after harvest for those oocysts to have enough time to sporulate to then be able to cause an infection in a new host. Meaning that this has to have happened by a person who contaminated that produce days to weeks before you got exposed to that produce and not an immediate exposure, if that makes sense.
Yeah. So basically the way you contaminate the produce is by infecting the water, right? Or by flushing the toilet, causing the water or whatever, and then you use it to potentially water the plants or
correct.
Right?
Yeah, so the water system is a very common way of causing like a bigger outbreaks. It can be also by decrease or lack of hygiene in people who have the disease as well, but that's usually more limited in terms of like the ability to cause bigger outbreaks.
Yeah, because that was going to be my next question. Is somebody goes to the bathroom and then they don't wash their hands and go pick up some fruits for you afterwards.
Yeah, and well, in this case, make sure to eat those fruits very quickly and don't take them with you and just keep them at home for days before consuming them. So the idea is to really think about it in a sense of like there is a time lapse that has to happen before this person could be contagious to you. They have to be contagious. That's why the people are contagious by, there's the produce that was made in a different country or a different state and then comes to you, and that has taken days, which allowed those oocysts to become infectious by sporulation, and then you become the next host.
Exactly. So basically, like eating them immediately after infection is better than eating them 1 week after they get
Correct.
infected.
100%. Yes.
And what are the most common things that we eat or foods that we eat that are currently causing some of the symptoms in the outbreak?
Yeah, I mean, it seems like in this situation, it seems like lettuce is now the kind of the front runner in terms of like the probable causes, at least of the big outbreak that's happening in the Midwest. And so like greens, like leafy greens, I would say is your big one. And that has to do with the fact that one, it's commonly eaten raw instead of being cooked. Because this something to say about this parasite is that it dies pretty quickly when exposed to temperatures above, I think, 158 degrees Fahrenheit. So it easily is killed in that way. So your problem is not going to be with food that has been gone through higher temperatures. It's going to be with raw food. And leafy greens, raspberries, basil, these kind of produce that usually are not cooked and are eaten raw. Their part is related to just the shape of the leafy greens. Some of them they have folds that allow these parasites to sit in there and colonize this area and sit in there. And then also they like to stick to leafy greens surface. Leafy green surface is pretty ideal for them to be there. And so that's what's allowing most of the time for leafy greens to be the running cause for these outbreaks. But as I said, some other fruits and berries can also be carriers.
What about kibbe or raw kibbe?
Definitely a potential cause of outbreaks, even though less consumed on this side of the hemisphere, I would say, than back home. But yeah, definitely anything that is raw could potentially be a source of outbreaks and contamination.
What are the symptoms people should look out for?
I think people should think mostly especially in the May to August time of the year, and maybe with climate change, we're seeing it extend a little bit more. If somebody's coming and having a diarrhea that's happening for more than a week, and that's like having this what you call relapsing remitting kind of pattern of the diarrhea, where it seems like as if it's getting better, but then it gets worse again, and it's just not going away, then the threshold of suspicion should be higher for this being. Now, you should think about it, obviously, if you're somebody who's especially living in the Ohio, Indiana, Michigan area, you should think about it with really any person who's coming with diarrhea that's lasted for more than a few days. But yeah, in general, in the US and around the world, because this is a parasite that's really present all over the globe, you should think about it whenever a person has had diarrhea, I would say for more than 7 days, and who is having this pattern on kind of relapsing remitting, as I said.
And how long after let's say you eat, I don't know, a salad, how many days after that do you start getting symptoms?
2 to 14 days. 7 days is your average.
All right, interesting. And how do you test for it? Like
that's the reason why, by the way, the investigation was tough. Because the range goes from 2 to 14 days. And that's in comparison with other infections like salmonella, usually incubation is 18 hours. So the person when investigation starts happening, you can immediately people will be like, oh yeah, 2 days ago I ate this, or yesterday I ate that. And so the CDC is able to quickly notice a pattern where people have consumed. But then it's like something that takes 2 to 14 days. People eat a lot of things in 14 days, and so, or even 7 days, which average kind of considered long, that makes it harder to figure out where this came from.
Yeah, because it's a big range and people forget what they ate 14 days
Right.
ago. They're not going to remember what you ate at that point in time. So when somebody comes to you and they tell you, all right, I'm having diarrhea and stuff like that, what do you do these days and how do you test them?
Obviously, trying as we try as much as we can in medicine not to anchor on one diagnosis, but taking things into context. So we're in the season, there's an outbreak that's happening. So if somebody's presenting now with a diarrhea that's lasted more than 5 days, it has been my kind of cutoff, but usually the average is more than 7 days, that's having that aspect, that pattern that I described to you, and especially if they're coming from one of the states with the highest outbreaks, then I would definitely, and if specifically in this specific outbreak that's happening in the Midwest, there was mention of having eaten at Taco Bell over the last that some of the produce that made it to Taco Bell has maybe made it and caused some of these outbreaks, and asking social history and making sure if somebody has had any of these exposures, then to consider testing them. And here testing is a bit more nuanced than your usual testing for diarrhea.
Yeah, what's the testing? Is it like PCR assays or is it ova and parasites in the stools?
The books like to talk about ova and parasites because that you could find it just with a cheap ova and parasite test, even though the sensitivity is not as good as the PCR testings that now we have more and more access to. So the ova and parasites, there are multiple ways to see them, but one of the common ways and traditional ways is to use actually the acid-fast, modified acid-fast, where you used a weaker acid. So usually I think they use the sulfuric acid that's a bit weaker than the hydrochloride acid with alcohol that's used in TB coloration, discoloration. And so you use a weaker acid and that will make it stain it, or the stain remain with, because the cell wall of these parasites have a lot of lipids, a bit similar to mycobacteria, but not as much. So that makes it colored in this pink to deep purple color, which makes it be able to seen on the ova and parasite test. But the reality is the ova and parasite test, as I said, you don't have too many people who know how to do it anymore. It's not a common test that people do in all hospitals on a regular basis. And so I think in technically there's some lack of technicians who do it. And so the most common way currently that we do it, at least within the healthcare systems that we work at, use the PCR testing and the panels, the GI pathogen panels that contain Cyclospora among them.
Right, exactly. And why is it important to test for it? Would the diarrhea go away on its own, or do you have to treat it?
Yeah, so this is all, so a lot of people, it will go by its own. But remember that host is not the last person in this outbreak, usually. And so it's important to know because, one, that helps the Department of Health, for example, in the state of Georgia where I live, but also all over the country and the CDC to know number of cases that are happening. So this is a mandatory reportable disease to the Department of Health. So it's important that from that perspective to know about it, just to save kind of try to protect society as much as possible. And so not necessarily for the person itself, but also the other reason is because there is treatment, and knowing that this is what's happening and treating it is also important for the patient themselves.
Who are the patients who are more at risk of getting like more severe disease?
Yeah, exactly. So a bit similar to most infectious diseases, you're very young, very old, and then the immune compromised. Those patients are the most at risk for severe illness, relapsing illness, and then even death from these infections. Fortunately, we haven't had any death so far from this outbreak at this point. But the patients with immune suppression are, so be mindful in the sense of knowing if you have patients who are young and immune competent, and you're like, do we even need to know? But the idea is to try to protect and be mindful of those who are more at risk.
And what's the current treatment for it once you diagnose it?
So trimethoprim with sulfamethoxazole is your treatment of choice, and that's given for immune competent patients twice daily for 7 days. And patients improve very quickly. That's usually a pattern where that's another sign, if you haven't had the test done yet, if the patient improves pretty dramatically in 24 to 48 hours, that's usually a sign, also another sign in favor of this being Cyclospora. So that's the treatment. Now for immune compromised patients, the treatment, especially like HIV patients, for example, who have a low CD4, you treat for longer, on average for 10 days, potentially longer. And even if the CD4 is less than 100, if I'm not mistaken, you can even have to give secondary prophylaxis, which is in a way already happening. But another reason maybe to do it, because if you're giving secondary prophylaxis for pneumocystis for low CD4, which contains a lot of people Bactrim treatment, so use that as also secondary prophylaxis. So another reason to give secondary prophylaxis for patients who have a low CD4.
And so let's say you got the infection, but you want to try. A lot of people are now very worried about preventing the infection. Some people are telling their kids, don't go to swimming pools this summer because we're worried that you're going to get Cyclospora from there. So what are some reasonable ways to prevent it? And what are some unreasonable ways that people can follow too?
And this is a situation where we're watching it closely, but big message, no need to panic. No need to panic. Reasonable common sense behavior is likely to be enough in this case. Cryptosporidium causes a lot more outbreaks when it comes to swimming pools and water fountains and things of that sort than Cyclospora. So I expect Cyclospora to be more related, actually not to go into swimming pools. I think that's maybe an overkill. And think about it specifically for Cyclospora. Obviously, if there's an outbreak of Cryptosporidium, and you can talk about it in that sense, but the common sense is don't eat mixed vegetable back now that you don't know where it came from and you don't know how it was or if it was washed at all. So just be mindful of the food that you're eating, like you do in general, but maybe be a bit more cautious about where you're eating, what kind of food you're eating. And at the same time, we don't want to tell people suddenly that, hey, red meat, that's cooked red meat is your go-to and that's it. You should eat that for the rest of the month. But so mixing, but at the same time, maybe lettuce, if you want to remove it from a specific sandwich that you're eating, I think that's a reasonable thing to do. And maybe eating at home, making sure that this is cleaned well, even though obviously none of the ways is perfect to make sure you get rid of the eggs completely. But those are ways to decrease the risk, and I think are reasonable.
Yeah, because what you're saying is even if you wash your vegetables, you still may not get rid of the disease.
Yeah, so you have to use water that's like strong water that has to come on the leafy greens, and a strong steam of water is really the only thing that has proven, and struggle to convince my Lebanese mom that as much vinegar as she will put in exposure to these lettuces is not going to be the solution. And so we don't have evidence for any of the common ways that we use for cleaning other than really just clean water is your best way. And it's still not perfect and might still not completely prevent it from happening, but it is your best bet.
So there's a way. But the best way to monitor is your State Department of Health and maybe the CDC, right? Eventually to monitor where these outbreaks started and then try to track them and prevent them afterwards.
Oh, yeah, 100%. Yeah. And chlorinated water, by the way, is not enough. And that's one other reason why they put enough fluoride in water, which protects against a lot of the bacteria and cholera and all that stuff to try to prevent these outbreaks from bacteria. But that's not enough for Cyclospora. And that's why that water, if it got contaminated and used then for watering systems for vegetables, the Cyclospora would survive and cause infections. So chlorinated is not enough, vinegar is not enough. And so keep these things in mind. And as you said, at the end of the day, the solution is to try to proactively try to examine the sources of these produce to try to prevent these outbreaks from causing harm.
When do you think this outbreak will finish?
That's a tough question. I do think that the seasonality is still there. Like, this is not an outbreak. Like, I would have been more worried if this is like an outbreak now happening in like January. Like, we're January of 2026 and there's like an outbreak of Cyclospora that's going on. That would have been more concerning. So we are seeing an outbreak on steroids happening, but happening during the season where usually Cyclospora happens. And as long as we are able to tell what the source is, and now that we are getting more and more information over the last 48 hours, I think we could start controlling the source. And with people and healthcare workers being aware of this happening and testing more for it, I do expect the numbers to start going down and decreasing the same way usually it decreases by the end of July, beginning of August, and things get better.
Great. Hopefully we'll get there. So 7 rapid fire questions right now. So what is the biggest myth about Cyclospora?
I think what I said at the beginning, which is, oh, I got it because my chef didn't wash his hands, and I ate the salad immediately at the restaurant, and this is why I got sick. This has nothing to do with the person who's serving you the food now or making the food immediately. So this is really something you have to think who touched the food and what touched the food days to weeks in advance, and not in the last 10 minutes.
So you're not going to know exactly, you're not going to see the source that led to this most of the times. What is one symptom clinicians should never ignore?
A fever that's relapsing and remitting. That's just patients tell you oh, I felt it was going away, but then it came back. This is not your usual virus, right? This is something unusual about it. And explosive diarrhea is one other thing that people are mentioning a lot, which is it is because it infects so many enterocytes that it causes these kind of malabsorption immediately that causes the explosive diarrhea. So it's a very also, I wouldn't say it's a pathognomonic by any means or specific, but it is something that's more common with Cyclospora than other foodborne illnesses.
Interesting. And what is one symptom clinicians should, actually, what's one diagnostic pearl every physician should remember?
That you could find it on an ova and parasite test, but that your best friend is going to be the PCR testing.
One public health message everyone should know.
We are all in this together, and that's been true throughout time, even though we get tired and tired of all the infectious diseases. But the reality is that a robust, highly functioning public health system is really the only way to control these kinds of outbreaks, and hopefully in the future, more commonly prevent these outbreaks from happening.
So basically, local public health systems and maybe even world organizations such as WHO and others.
Correct.
Excellent. If you could change one thing about how we approach foodborne diseases, what would it be?
It's really making sure that we have a more robust active surveillance system of the water systems that are used for irrigation of farms, and having really just being proactive, really going back to the initial message of preventative being better than kind of treatment. And so trying to prevent these from happening and being active. And we've seen some of it done, for example, with COVID, when a lot of times before an outbreak happens, they would start seeing in the stool the increase in the water systems of COVID RNA that was there. And so trying to create systems as well related to foodborne illnesses would be great.
What is the single most important takeaway you want healthcare professionals and the general public to remember about cyclosporiasis?
That it's here, it's increasing in numbers, probably will continue and persist over the next few years. And that I want people to be kind and mindful, that always think about the weakest in our society. And so even though, fortunately, most individuals are not at high risk for severe complications from this infection, to always be mindful of our grandparents, our very young children, toddlers, and of our patients with HIV and our patients who are immune compromised, who are battling cancers or organ failures and having transplants. So thinking about all of them whenever you're dealing with an outbreak of that sort, because we are all, as humans, we are the only host. And so we are in a situation where there's us and one kind of enemy, if you will. And so think about it in that sense of a human purpose of trying to protect yourself, but also protect those among us who are the weakest.
Exactly, because while you might be fine and you could do well, but like you said, 14 days down the road, you might be infecting somebody who might actually pass away from the infection and you wouldn't even know it yourself. That's why it's important to prevent it and test for it quickly. Thank you, Wassim, for being on the podcast, and hopefully people learned about it. And I'm sure I've learned a lot from you today.
Thank you, Khalil. Thank you again for having me, and hope to see you at ID Week in October in DC.
Yes, for sure. Looking forward.
All right. Take care.